A really scary situation for any owner would be if your animal started having a fit, or what we would call a seizure. This can happen at any time. We have them when a dog is out on a walk and it suddenly stops and has a seizure. We also have them when they're at home and they're asleep, and the owner will wake up because they hear their dog thrashing around and realise that it's having a seizure. The most important thing is try not to panic in those situations. You cannot stop your dog from having the seizure. You need to just let him or her have the seizure. Try and stay calm around them, speak quietly and calmly to them. Ideally, turn off any bright lights that could be stimulating them, because that could make the seizure go on for longer. Turn off any loud noises that are going on in the background as well, because again, any extra stimulation can make the seizure worse. The reasons they might be having a seizure, it could be through a poisoning. They may have ingested something while out for a walk that you were unaware of. Something like slug bait, for example, would be one that would cause seizures. It could be, depending on their age and breed, that they are developing epilepsy. The other reason you may get a seizure is if you had something growing in your brain, so a brain tumour or a brain swelling, a hematoma. If you've had an accident or a knock, a trauma to your head, then you could see a sign of having a seizure. What you need to do once they've had their seizure, or while they're having their seizure if they're not coming out of it, is to phone your vet. And even if it's out of hours, there is always a vet at the end of the line that you can speak to. Describe to them what's happening. Ideally, let them know how it started if you saw it start. So were they conscious? How long were they conscious for? Did they lose control of their bladder? Did they defecate all over the place? Have a look at their eyes if you can after they've had the fit. Try not to touch your dog while it's having a fit, because it may involuntarily bite you because it's not in control of what its muscles are doing. Once you've had a look, if you can look at its eyes and see if there is any involuntary eye movement, as in, is it the eyes moving side to side or up and down? Again, that gives us a clue to what may be happening, and also allows us to give appropriate advice of whether we need to see your dog immediately, or whether we would advise that you give them a little bit of time before you bring them down to us. In most situations, if a dog has had a fit, we would want to see them, but we wouldn't want you to stress them out by bringing them straight down in the car. If they'd had a cluster of fits, 2 or 3, we would suggest that we see that dog quite quickly, because the chances are that it is going to go into another fit, and we need to be there to give them the appropriate medication to prevent that or to treat it as it's happening. The more fits your dog has close together, the more damage it could be doing to their brain, and we need to prevent that from happening. If we have a dog that's been diagnosed with epilepsy, we would monitor the frequency of their fits initially. If they're happening at a frequency that is not okay, so if it's 1 a year, we wouldn't start a dog on medication, because there are side effects to any medication that you give them. So you've got to weigh up the pros and cons of giving them the medication or allowing them to have a mild seizure once a year. If we were to start a dog on anti-epileptic medication, it would need to see us regularly. We need to check the bloods mainly to make sure that the levels of the medication are right in the bloodstream. If they're too low, then they won't be stopping the fits. If they're too high, then we should be lowering the level of the drug that we're giving them in order to stop those fits. That's the maintenance of an epileptic dog. What we would normally dispense to any owner with any seizuring dog, whether it's epilepsy or not, would be a tube of rectal diazepam. So this is something that you could easily give your dog at home without having to go around their mouth or their head end, and you just give them the diazepam quite safely into the rectum, and it's absorbed very quickly and will in some cases stop that seizure quite quickly, allow you then to get your dog to the vets where we can give them more medication, probably intravenously if needed, to stop the seizures.